Okay, Saroj, it has been one of our privileges, really, to know you. We first met you on the lobby of the medical school in 1974. Uh, and we formed a very strong bond then. And when you, being a Jayasinghe, was unfortunately lumbered with the Jayatunga in the in our sort of groups, particularly in the dissection room. And you were, well, both of us really were quite a strong combination. You tried your best to keep everybody awake with your antics and your jokes, while I tried to concentrate on the cutting bit. Anyway, throughout the medical school, we became very close friends. And there was a very formidable group that was formed. Myself, Radhika, Ranjan, and Kumudu. You missed out on getting your life's partner from that group. I don't know how. Anyway, there was Trisula, Champa, and hopefully he is with us today, Ganepula. So the 8 of us were quite a strong study group that shared our knowledge and our ideas. Well, I learned a lot just from being around that group, because all of you were intellectuals compared to me. I was the playboy of that group. These are your credentials, which I won't go into. This is you trying to look serious, which was a very rare occasion. You can never look serious for any length of time. And these are again your credentials. And this is your write-up on the Google Scholar site. You were the founder of the medical education department, development department, and the research center, the MEDAC. Your clinical research interests included innovative teaching, health equity, social determinants of health, and application of complexity science. That itself is an unknown phenomenon to me. And of course, your interest was on improving the population health. And your publications, there were 221 listed, and on another site, I thought there were 257. And there were 2,491 citations. Of the 221, there were 25 high-index publications on a wide variety of common pathologies that you wrote as the head of the Department of Medicine, which is sort of expected. Dengue, filariasis, diabetes, malaria, CKDU, and leptospirosis. There were many articles from you. But you wrote more extensively on the socio-cultural medical issues, health inequalities in developing poor income nations, language issues in medical literature. You wrote about the Millennium Goals to end all wars, which is very close to our hearts, racism in medicine, health provision to rural communities. Then I think Damani, your dear wife, stimulated you to think about suicide preventions, the burnout phenomena, body and mind split, and bullying by our teachers that we face. You also contributed to medical education, problem-based learning, um, and since 2020, your team had a huge increase in your publications, mainly COVID-related. You wrote about modeling, predicting, reasoning for COVID, drug repositioning, and the effect mainly on the rural populations, not only in Sri Lanka, but in Africa as well. And application of complexity science to pandemic situations. In the early part of your career, you were given the task of bringing the medical teaching establishment to the new millennium, dragging them up from the old methods of teaching, and you set up the MEDARC. And then you introduced behavioral sciences into the curriculum. And then you became, later on, you extended your interest to by forming a Department of Medical Humanities and held its first international conference in 2018. But your swan song was really to lead the 150-year anniversary of the Colombo Medical School, which was a huge success. You refused any pharma help. You funded it all very frugally and held everything in a, in a medical school using all of the facilities that there was, and it was a huge achievement, and I salute you for that. So Saroj, the man that I know, you are effervescent and you are an entertainer. You can't go 5 minutes without entertaining. You are artistic. You have a very good hand. Your best subject is yourself. I tried to get one of your caricatures into this, but you wouldn't send it to me. You will probably be drawing a caricature of me while I'm talking, I know that. You're versatile. You demonstrated that by organizing that fantastic conference. And your versatility was shown in the many subjects that you tackled during that conference. You're controversial. You always deviate from the standard path of our thinking of the rest of your colleagues, and you think differently, and you always bring out a different point of view. You're resourceful, and that again was shown in all of the achievements that you had. You are basically a socialist and a humanist. Your heart bleeds for the poor people and the humanity. You are intelligent, that's of course very well known. But I wouldn't call you a brilliant musician, and I wouldn't say that you had a huge interest in the brain. So this topic that you selected is controversial, just like you are. So put us out of our misery and please take the floor and show us, tell us what you want to tell about music and the brain. Thank you, Saroj.
Thank you very much. And once again, my sincere thanks to Sri Lankan Literary Society, especially Rasika, Ruan, Aja, and Mahendra for taking the risk of inviting me. So let me share the screen and then see how this works. Okay, so let me, I think Aja, there were a few errors. This is my current status because I have I'm retired from the Faculty of Medicine, Colombo, and I've been an academic from 1982 in Colombo, and I studied also in Colombo, and of course my primary education was in Ananda College, and one of my teachers are here. This is Lakshmi Perra. So thank you very much, teacher. So I would first try to explain why I have chosen this topic.
Saroj, I am also there listening to you.
Yes, sir, of course. Sir, you're part of it, sir. Lakshmi Perra is, that's why I spoke especially of Lakshmi Perra, and of course, Prof Lamabadha Surya. I don't know who else is here, but yes, sir, thank you very much for all what you've done. And even during my, I mean, even now, I think you are still influencing us in directing us to Sabaragamuwa and so on. And we are having a very interesting time, wonderful time in Sabaragamuwa with my colleagues. And some of us have rejoined. Yeah, some of us have rejoined to this former group. So we have Kumudu, Ranjan also in the group, and Joe has joined us, Malik, Damani, all of them are there. And I'm sure some of the students are listening to this. So once again, a warm welcome to the
Kumara
students.
Mendis as well.
And Kumara Mendis also. Yes, okay.
And
so,
Jean Pereira.
Yes, that's the latest edition from Forensic. Now, may I briefly tell you why I chose this topic? You see, I was fortunate enough to be at the, what shall I say, at the epicenter of curriculum reforms in late 1980s. And in 1995, we introduced a new curriculum, and that was led by Professor Nalaka Mendis, one of my mentors. He's a former chair professor of psychiatry in Colombo and now emeritus professor. So he was instrumental in bringing several reforms, and he is the one who brought in the behavioral sciences, conceptualized the need for a medical education research and development center. And with the behavioral sciences, we brought in a different perspective of teaching learning to our students. So that included exposure in ethics, in communication skills, on personal development, on professionalism, and so on. Now, this evolved over a period, and then in 2016, now I won't go into details, but in 2016 that we started the Department of Medical Humanities, the first such department in Sri Lanka and probably many parts of Asia, South Asia certainly. And again, I must thank Prof Jennifer Perra, who was again from our batch, who was the dean at that time and who pushed hard to get this established. And as you know, you have to justify cadre, you have to justify why you're having a new department and so on. So that's where this whole, the history of the background, as it were, for this topic, because when we began, the idea of why we should bring in medical humanities was still very vague to us. Was it something fluffy which was there, which was nice to do? Or was there a real basis? And that's the time I started to explore this link between the aesthetics and the brain. And there is a huge amount of literature which we unearthed on this link between the mind, the brain, and the aesthetics, and how it promotes compassion, empathy, and all this is being shown now using the brain and its functioning. So we are not talking of something which is just which we have thought of, but you can really see the brain circuits progressing and doing things and why it happens. So this is why I chose this topic, and well, it's controversial at one level, but I think we will explore this topic in further detail. So my talk is going to be in 4 major areas. One is, I'll just give a brief introduction to the brain because there are people who are non-medical in this audience. And then we'll see how brain was responsible or is responsible for music coming out in evolution, and also how music helped the brain to grow. That's an evolutionary part. Second one is to explore the effects of music on the brain, and then music as a form of therapy, again mainly through mechanisms in the brain. So that's the slide which outlines it. And role of brain in the origin of music. And when you talk of effects, we'll talk about creativity or the compositions and how the brain functions to compose music. What happens when we train to the brain? What happens when we listen? What happens to the brain when we are listening to music? And then forms of therapy, Western, Indian, as well as Sri Lankan tradition. So very briefly, you have the spinal cord, the brain stem, and this is the cranium is the one with the cerebrum and its cortex. Cortex is the surface of the brain, which is important. And we divide the brain into different lobes. You have the temporal lobe, frontal lobe, parietal lobe, and occipital lobe. So there's some degree of specialization. And this outlines some of the important features. So you'll see that the cerebellum, the spinal cord, and the brain stem, and so on, they deal with movement and balance and so on. While the more intellectual functions are in the cerebrum. So you have visual cortex, where the occiput is, the occipital cord, the occipital lobe. You have parietal, which responsible for sensation. You have the frontal, this part, you have in relation to movement, but there is a prefrontal part, which is very important for judgment, problem solving, and so on. And that's the one which gets atrophied. One part which gets atrophied with dementia. And you have the temporal lobe. Now, I think the screen has gone. Can you all see anything, or has it gone?
No, just a blank white rectangle at the moment.
Yeah. Let me try again.
Yep.
Yeah, it's coming back. Yeah. So, so those are the sort of functions which we have. And also, when you look at the brain from a different perspective, if you look at the mind, as it were, you can see that there is on the surface you have the thinking brain, then you have an emotional brain, what we call the limbic system, and the more instinct one which you find below. So that's when you look at it from a mind's perspective. And there are various theories of this, but now we know that it's all together. In fact, I mean, it's difficult to differentiate this, but you get these networks which you see. And that's another interesting thing, because right now we can see areas which are functioning, but you have the next generation of research is going to be on the connections between these, what they call the connectome, and the wiring actually. So that's something which will happen in future. Okay, so just a small example. When you're reading a text, or you're listening to music, or you're reading something, several parts are used. You see it, and that gets comprehended. And then if you want to speak out or recite it, it goes into your speech area, and the speech area, from there it will go to the motor aspect of the area which controls the motor aspects of the brain. So just reading out, we'll have so many networks firing. So that's a very simple outline about the brain, and I will now show you how we are investigating this. And this is important because just to understand why there is such an explosion of research. We are able to look at the structure by MRI, magnetic resonance imaging, which is an advancement on the CT scan. I mean, most of us, when we began our medical school days, MRI scans and CT scans were not there. But later on, we had CT scans, and now, more recently, MRI scans. And the advancement of the MRI scan, the MRI scan shows you very good structure of the brain. So you can see, and you can do 3D reconstruction, and it looks as if the brain is in front of you. Okay. Now, the advancement of this, a lot of studies was when they developed magnetic resonance imaging, which are functional. So you had a system of checking on the blood flow of the brain. And so if you are thinking in a particular area, when you think your brain is requiring more energy, the blood flow to that area will increase, and that's captured by functional MRIs. So we have now come to a situation where we can really look at not only the structure, but also the areas which are functioning when you are thinking, reading, speaking, meditating, and so on. So that's a huge advantage we have now. And this is complemented by EEG, electroencephalograms, which assess the electrical activity in the brain, and then you can do so many tests of psychology and things again to try and see how the mind is functioning. So that's an outline of the structure and how we can investigate. Now, let me take the first area, the role of the brain in the origin of music. Now, this is based on what we call the social brain theory. See, there are various reasons given to us as to why humans have such a large brain. So if you look at cut the brain and look at the new cortex, the thinking cortex, you find that actually in primates, you find that the humans have a large neocortex compared to monkeys. And you see this even across apes. So it looks as if humans are having a larger thinking brain for some reason compared to the apes, or when you compare it with the monkeys. So the reason for this, there are various theories. One theory was that we started to use tools. That's why we had a thumb, and we were able to grip, and therefore we produced tools, and therefore our brain started to function more and more, and you have selective pressure in developing parts of the brain. But the social brain theory, which is from the 1990s by Dunbar and team from Oxford, they looked at it in a different way, and they linked it to the social systems. So what their theory was that the brain developed because people started to live in communities, and these communities grew, and in order to interact with these within these communities, the brain started to grow, and selective pressure came for us to develop the new part of the brain. So you have primates having more complex social lives, having large brains, and these large brains are managing complex social systems. Great apes also, you see the same relationship, and it's this need to have friendships and so on, which is actually increasing our cortical mass, the new part of the brain. So that's the sort of theory which we will look at and see how that helped music to come along. So now this is a figure from Dunbar, and you see the growth of the neocortex, how it's related to group size and influenced by this type of hunting, etc., and so on. Just for completeness sake, I put this. Right. Now, in order to communicate, or when you're communicating, your communication within a group included articulation, sounds which came, and certain gestures. And the theory is that these also mimicked some of the natural sounds, and music was actually part of this process. So music, in a sense, expanded your ability to have social contacts, to develop friendships, and to communicate with people. So the idea is that music was part and parcel of the growth of the brain, right? So it's a key element which you see in evolution, and it's originated with the social brain, and instruments came later. The musical instruments, they came later, and there are some instruments they found. Now, this is somewhere near it's 35 to 40,000 years ago. That's from Germany that they found, and then there's recorded history of orchestras in Egypt. So again, several thousands of years ago. So over the years, things have evolved, and now we have a situation where music is getting produced artificially, and artificial intelligence actually can start to compose music. So now let us get on to the effects of music on the brain. So firstly, I've described how evolution, the social brain, and music are linked. Now let's see how music really affects your brain, and in fact, it affects the whole brain, right? So we will look at those different areas, but it affects the whole brain. And here it's important again to introduce a term called neuroplasticity. Because when we started as medical students, we were told that the brain does not grow. Once it's set, there is nothing else happens. But now we know that if you go on using certain parts of the brain, it grows. And actually you can have structures and new connections being formed. Not so much cells dividing, but cells sprouting linkages. And this is called neuroplasticity. Neuroplasticity. It's plastic, malleable. And we will now look at this in 3 areas. One is creation of music or compositions, then playing or training, and finally, what happens when we listen. Now, this is the Beatles composing song, and you see, when musicians are producing songs, they go almost in a trance. They jam and they play together and various combinations. I'm talking not of the words, I'm talking of the music. Because the words, the creation of words is a different ball. Creation of art pictures is a different topic. Creation of music is, again, they've looked at it, used functional MRIs, and they've found some of the areas which are important in music creation. Now, we haven't to remember these different areas, but it just shows that certain areas light up when you're composing. And how do you do that? They actually got people to go inside the MRI scanner, especially jazz players. They improvise and they create based on a structure which they start off with. And so inside the scanner, they've asked to improvise. And then you see which areas are lighting up. Now, though certain areas are lighting up, what's interesting is certain areas are getting suppressed, right? So the person who is writing the tune seems to suppress the area which is involved in words. So your processing of words and things get suppressed, whereas certain areas are lighting up. So certain connectivities of networks related to vision and sensory areas of the cortex and processing of words seem to get suppressed or decreased activity, while there is strong activity in these other areas. So there seems to be some specific brain state of musical creation. So anyone who's creating music seems to have a similar pattern. Now let's talk about training and practice of music. This is a picture. By the way, all these pictures are from the public domain. None of these are mine. And this is actually the Trinity College team of students who are practicing. And what's interesting is that when you train, there are changes which happen. When you play music, there are changes which happen. Now, if you want to look at it in further detail, you will see that, I mean, each area, there are examples given here of areas showing increased activity and subsequently showing increase in the number of gray cells and so on in those areas, the gray matter, because it's sprouting up more and more. So if a person goes on listening and hearing and playing, certain parts of the brain will show increased activity and there'll be neuroplastic changes. I told you about neuroplastic changes. The brain will grow in that area. So that's what we mean by neuroplasticity. And the more you train, the more that area will grow. And people who have that area which is responsible, which has grown, would be better performance. So if you look at the brain, I mentioned about the cortex, and there's the area which represents the movement, the motor aspect. So there's one important principle: the right side of the cerebrum, that's the brain. This is a section cut vertically. The right side is responsible for movement on the left. So if so, you imagine a violinist who is all the time playing the violin. So the left hand, the fingers are moving all the time. You're practicing, you're playing 4, 5, 6 hours, and they say expertise takes about 10 years, and if you go on doing it, you would expect the violinist, this area of the cortex, which is responsible for the left hand, to be thicker and grow. And that's what you see when you do MRIs. So you do an MRI, 3D reconstruction, and you see that the violinist has what they call this inverted omega sign. That's omega, that's inverted, and that's the inverted omega sign, indicating that this side has got more hypertrophy. Whereas with a pianist, the inverted sign is mainly on the left, because it's a right hand which is playing much more than the left. So, so in other words, your brain does change with music. So now let's look at, that's with training. Now let's look at what happens when you start to listen to music, right? When you're listening to music. Now, when you're listening, there are so many changes which will come, and this is just a small question: which brain do you think is listening? Right? And this indicates red is more active, least active is blue, in between is green and yellow. And you'll notice the answer is B. This is a person who is listening to music. Okay, so the brain is, the whole brain seems to be get stimulated, because if you recall, when you are listening to music, you start seeing things, you start remembering things, you start to see the players who are playing the orchestra. And when that happens, actually your different parts of the cortex is getting activated. So with listening, you do get so many changes in the brain. And this is a bit more in depth. So once you hear, it goes to the auditory cortex. But from the auditory cortex, emotional evaluation, there are certain songs which bring back flashes of memory, right? And you seem to be living in that era, in that period. So some of us who will be listening, maybe Amaradeva or the Beatles or whatever, and you suddenly are going back in time. And when you see that, when you're listening to that piece of music, there are so many visuals which come in. So your visual cortex is getting activated. You see them playing the music, then with that, even your motor cortex gets activated. So in other words, actually music is like a food to the brain. Okay, and it does really have a remarkable effect. So now going back again to a bit of hard science for the medics here. So when you listen to music, your motor system is getting activated even though you're not moving, right? That's the mirror neurons and so on. When you see someone playing, or when you imagine someone playing, your area of the brain which you would use to do the same movement also starts firing. So there is widespread activation of the motor networks, the networks which are responsible for movement. And there are connections to your thoughts and emotions. So again, several other areas get activated when you listen to music. So this activation, depending on the type of music, you can activate certain emotional processing areas. That's your limbic system, right? And you might be activating certain reward processing areas. Okay, so these are things which if you really reflect, you realize that these are the things which happen when you listen to pieces of music. Now, they've done research on the type of music. So when you have music which you prefer, which you have heard before, so if you are listening to an old song of Amaradeva or the Beatles or one of your favorite songs which you've heard as a child or during your adolescence, you will suddenly get those images which are coming from your long-term memory, right? What we call emotionally laden, because it's emotional, some of those autobiographical. It's your life story which comes out. So actually you're not producing new memory, but you're tapping into memories and things which were there. So it's not memory formation that is critical when you're listening to preferred songs. It's you're retrieving some of the memories which were there. And when you listen to pleasant music, you seem to be activating certain areas. When you listen to unpleasant music, you seem to be activating different areas. Now, all these have been done using functional MRIs. Now I get on, this is the brain. Now I get on to something very interesting. The peripheral effects, again, which are mediated from the brain, which we experience, right? Now, some of us, when you listen to your national anthem or your school song, you get goosebumps. Not only that, certain other songs also creates goosebumps. It's a pleasurable sort of experience, and with it you have your heart rate can go up, your skin conduction changes because the sweating, the amount of sweat produced changes, and there is contraction of muscles which are linked to the hairs. You get the goosebumps because of that. It's what we call a chill which happens, right? You experience a chill, and there's been a lot of work on this area, right? And it's, in fact, some would call it skin orgasms, because you get a thrill which you feel, and technically the term is also called frisson, and or called an aesthetic chill. An aesthetic chill. So there has been some work as to find out what brings on this. And if you recall your own experience, so it might be the national anthem, or it might be a certain segment. Now, for example, now take a example from the Beatles or from George Harrison, when he's singing "My Sweet Lord," and there's a point when Ringo starts on the drum, right? And that's a point of aesthetic chills for me, right? And you repeatedly get that. Or it might be a song from Amaradeva or Nanda Mali, and then you suddenly get a thrill at that, with a change in tempo, with a change in key. And a crescendo. So when you look at it, you find that these aesthetic chills are triggered by several aspects related to music. It's a very personal sort of experience you have. It's a pleasurable experience. And when people are singing in a concert, you see that they go bonkers. The people who are listening as well as the people who are playing, because you are in that state of ecstasy without drugs on a chill. So when you look at it in depth, you find that the chill moment, you can explain it from hormones or from the nervous system itself. Whole lot of hormones are released, right? So you have the central noradrenergic system. This is the sort of system which the fight response which you have in the body, but there's a center in the brain which functions like this, and there seems to be a surge. There's a surge of the dopaminergic system, the dopamines, and they have worked out some of these pathways, right? So there are impulses which go right round, and also there are impulses which make the adrenergic, the noradrenaline amounts in the brain to go up. There are neural theories, so that's the hormones. You find certain hormones going up at that time. Plus, there seems to be some modulation of parasympathetic nervous system because it's in a particular area, right? It's called autonomous sensory meridian response because it's in the meridian, it's in the midline. It's autonomous, it happens automatically. You can't bring it on, it just comes. And it's a sensory response. So you have this tingling, feeling of tingling, and then you find the goosebumps and so on. Right. Now we get on to music as therapy. So music as therapy, again, you find that the brain is playing a key role. Now, this is a picture of a music therapy session in the Cancer Institute, Mahengee, which is now renamed as Apeksha. And we know that music, in addition to reducing blood pressure and reducing stress, through neurological mechanisms, it improves the memory, it enhances your ability to counter pain, and so on. So there are several effects of music, some of which are mediated through the brain, some set differently, which have beneficial effects. And when you look at the mechanics of it, you find that the music therapy is also having, in addition to a neurological, the nervous system, there are changes in the hormone levels also. So you have various systems of hormones like dopamine and opioids, which are released. You have an arousal also. Sometimes the music brings on certain arousals. Your stress levels can go up depending on the type of music. The immunity levels can increase, and certain emotions can also come about due to music. So there are various mechanisms of action, and music is used as a therapy. And one of the main mechanisms is that it acts to the brain. So when you have, when you get people who are having, having low mood, elderly people, when you get them to listen to concerts, they feel better. The mood improves, and if they are having chronic pain, the pain levels go down. People who are ventilated on ventilators, if you play them music, their when they recover, you find that their recovery rates are faster, plus their subjective experiences are much better than people who have not had music in the intensive care unit. So there is research to show the importance of music in therapy. Another area is traumatic brain injury. And you can expect this. Why? Because you saw the effect of music on the whole brain. So if you are listening and if you get them to listen to the correct songs, you see the impact. You will see beneficial effects. And then you know of neuroplasticity. So if there is brain injury or if you are having a low mood and so on, when you play music, it has to have a positive impact, depending, of course, on the music. But it's very difficult to get this across to people. Now, right now, I have a patient who's in her 90s who is her hobby was sarpina. You know, she used to play, and though she's in her 90s, until a few months ago, she was playing music to her grandchildren and so on. So, you know, you repeatedly tell them, get a cassette or get a CD and play it, keep it near her ear, so that she will be listening to music which she has heard before. I mean, otherwise you are in the ICU and you are hearing beeps or nurses shouting, thinking that everybody else is unconscious. So, you know, otherwise there is a lot of noise in these ICUs. And imagine if you are stuck, you can't move for days, and there is a piece of music which is going on, which you can relate to. So these are simple things which we should be using. Now I get on to a few other areas of music in a therapeutic format, which are very interesting. One is the so-called Mozart effect. Now, certain sonatas of Mozart, when you play, it seems to improve the problem-solving capacity of people. So you give them a short, you get them to listen to Mozart. Another group don't get music, they get something else. Right? And you get them to do these IQ tests, which are spatial reasoning. Not so much the verbal and the mathematical reasoning. When you give them spatial tasks, Mozart's music seems to have a positive influence. And this tends to last for some time. So very interesting. Again, you can think of it, why it should happen, even though we don't know the exact pathways, because again, music is affecting the whole brain. Okay, and it probably stimulates and prepares the brain for spatial reasoning. Now, this has been appreciated by Indian musicians. So the ancient music texts of India, the Rag Chikitsa. So the Eastern cultures seem to have recognized this, and it's there in their texts. And if you look at the recent literature, you find studies which have used music using the different ragas to see their impact on physical illness. So they probably act through the autonomic nervous system. These two studies are from Sri Lanka, headed by Ruwan Ekanayaka, cardiologist. That's our Kumudu, who is also part of that team, and where they used a certain Indian classical music to see the impact on blood pressure, pulse rate, and respiratory rate. And you can use it even to show that there's objective improvement of the cardiac status. It seems to slow the progress of cardiac disease. So we don't know the exact mechanism, might be an indirect influence on stress levels and so on. Now, if you look at South Indian music, again, you find a few studies where they've used the South Indian tradition of music and which have been used to relieve cancer pain, as well as post-operative pain. So if you play music prior to the operation for 3 days, and then give them post-op also, you give them the audio CDs for them to listen, you find that their pain scores are less. So these are most likely working through the brain. Now, finally, just to touch on the Sinhala traditions, which we could explore a bit more. And this is, of course, there is dance forms also, but with the dance forms, there is reciting and there is a lot of other factors which come in. But here, these are rituals, right? These are rituals, especially in the lower country, in Ruguna and Tesa, in those areas. So you have these toil ceremonies, and in the toil ceremony, they describe the Dahata Sanghi. So that is where you identify certain diseases, and your ceremony is to get rid of demons who are causing those diseases. So they've identified, this is a publication from the BMJ, which was published in 2006, and Janaka De Silva did it with another co-author. And they showed the link between the masks of the Hatha Sanya with the illnesses. And you will see that some of the illnesses are related to the brain. So you have people about dumbness or deafness or paralysis. And the belief was that these were spirits, and you're using music now and dance and several other activities, rituals to drive away the devil. So it's very interesting to see how even traditional forms of music have been used. And the question which we hope to answer very soon, is to see the effect of spirit on your brain. I mean, what's the sort of effect will it have? So we're trying to work with the University of Moratu on this. We can't do the functional MRIs, but we should be able to do the EEGs. And of course, we welcome if there are collaborators from there who can do some of the functional MRIs in the UK. So I think there are a lot of opportunities to explore this link between music and the brain, and there is a whole body of research which can be done. So just to summarize, what I've tried to do is to outline 3 major areas where the brain and music are linked. One is in evolution itself. So we are probably programmed for music. Now, second thing is when you listen, play, compose music, your brain really lights up. So if you want, I mean, there are studies on progress of dementia being slowed with music and so on. So, and it's understandable because when you listen or play, there are so many areas of the brain which starts to function. This is why they say it's never too late to start a new instrument, learning a new instrument. The moment you do that, you're challenging your brain to function. You haven't to be an expert, but you're challenging your brain to do new things and to form new circuits. Then finally, the brain is playing a role in what we call music as a form of therapy. You have art therapy, dance therapy, and so on. But music also is a form of therapy. So this is all the facts I've got to say. But this exploration is helpful to us to convince why it is important, for example, to have music and the arts as part and parcel of our curriculums. So if you are, I'm talking of medical students, why we should bring in the arts to the curriculum, why it should be, it should be a part of it. It's not something which you do only as an evening concert, but recognizing it as a part and using it positively, even for our students. For one thing, even if we leave aside everything, I mean, it gives them enjoyment and relaxes everybody, and it just reduces the stress and so on. So thank you very much. I think that's all I've got to say. And once again, my sincere thanks to all of you for listening and for inviting me. Thank you.
Thank you very much, Saroj. Will you take some questions, please?
Yeah, Ajanta,
Yes.
could I start off?
Yes, please.
Yeah, first of all, I would like to congratulate Saroj for exposing to all of us another facet of his diversity, which was, I think, appreciated by nearly 80 people who participated in this program. Now, Saroj, many years ago, I read a letter to the editor in the British Medical Journal, where a doctor, a lady doctor, who said that when she was pregnant, that she listened to a particular piece of music during her pregnancy while she was doing her housework, cooking, etc. And when the baby was born, that baby sort of started crying incessantly, and she could not fathom why the baby was crying. And she tried various medications, but those didn't work. But then when she tuned on to that piece of music that she was listening to when she was pregnant, the baby stopped crying. Now, implication is that the fetus was conditioned in utero for that piece of music. And the baby stopped crying when that baby started hearing that music again. What do you have to say to that?
So there is research on using music during the preterm period also, because the babies do hear at least the lower frequencies they are able to hear, and definitely they might be hearing some of the voice of the mother, which gets transmitted through solid as well as liquid. So it's very interesting, because if you look at the sort of cultures which we had, you see, where we had mothers singing, they used to recite kavi for during pregnancy as well as during infancy. Now we have changed all that with Montessori or whatever, which has changed. I mean, we have removed all those wonderful things which we do and just brought in something which is totally probably alien to us. But these were there. These practices were there, and agreed. I mean, there is evidence of influence of preterm music on subsequent behaviors of infants. Yeah.
So in that case, Saroj, is there a place as a part of antenatal care to sort of play recorded music when the mothers are pregnant?
Yes, I mean, there is. The thing is, I mean, I'm sure that I haven't looked specifically recently for such evidence, but the impact of music goes right across all age groups, from childhood up to, even when you are dying.
Yeah,
it's, you know, even when you're dying, it will be nice to listen to a good piece of music.
Hi.
yeah.
Hi.
Now, Saroj, the next
Yes,
question is, now if you sort of we talk about disuse atrophy of our muscles, if we don't use them for some time. For instance, if you are paralyzed for some time, the paralyzed side, the muscles will waste away because of not using those muscles. Now, does that apply to the brain?
Yes.
Is there disuse atrophy of the brain?
yes. If you don't use certain areas, I mean, that's why when even if you look at studying, when we repeated exposure or repeating something, presumably keeps the pathways, the networks functioning. So I don't know to what extent it atrophies, but certainly that sort of atrophy is not what is responsible for dementia, etc. Because there is some disease process going on there. But the opposite is something we know. That is, for people who are having diseases or disorders where the brain is slowly aging or atrophying, the more you stimulate with music and of course with other activities also, the better you become. Your cognitive deterioration slows, you are able to function better and so on.
Okay, Saroj, thank you very much. Now I
Thank
will
you.
allow others to ask their questions, and I have some more questions to ask you at the end of the program. Thank you,
Right, sir.
Saroj.
Saroj,
you
can
very
you
much.
stop screen share, please? Thank you. So that we can see everybody if you stop screen share. That's better.
Thank you. I think Lakshmi's hand was raised first. Lakshmi, do you want to ask your question?
Yes, I like this role reversal, Saroj, very much. After 47 years, I ask you questions. You used to ask me questions. So, a very simple question I'm going to ask you, Saroj. Now,
Yes.
I know in Buddhism also, we have these 6 senses. Only one sense at a time we can concentrate. If you read, you can concentrate in the eyes, eye consciousness. If you listen, it's ear consciousness. But some people have the habit of having this classical music in the background when they do maths and all that, studying workout questions, and they say that seems to be helping them. Is there in your studies, is there any relationship to that will facilitate the music, facilitate your thinking ability while doing a maths problem or something like that?
I think that there is, there are studies showing both aspects. Certain musical, it depends on the loudness and the type of music and what music you're listening to. They will help you in your cognitive tasks like maths or creative tasks. So you have music going on when you're doing a painting or whatever. But certain studies have shown that it doesn't help because you can get distracted. So if you're listening to some music, and the moment your mind goes to that, your mind can actually manage, and you're doing a maths problem and something you're hearing the music and your mind goes to that, then you're breaking attention on the maths problem. So there's research both ways. I think if I'm to hazard a guess, I think it is a very personal sort of an experience. Some would find it very pleasant and nice to have it, and they should do that. But others might find it that it disturbs. Yeah.
According to my experience, according to my experience, if you are doing generally anything, you can have music and you will love it. But if you have to concentrate very much or finding something in the computer or something, the music, I tend to off the music and concentrate on that thing. So that shows one task can be done at one time. Also, for some tasks, music will generally create an atmosphere conducive to that task. That's what I gather.
Yeah, I think you are correct. Thank you.
Yeah. Okay. And really singing also helps, like doing a music, the instrument, isn't it?
Yes. So when you're singing, there are so many other areas which get triggered. So, so singing, and in fact, now when you're singing and dancing, it adds some more because you're bringing in movement also. So again, there's more areas of the brain which are affected.
Yeah. Thank you very much, Saroj, and I wish you all the best. You have lots of years to do lots of work to humanity.
Thank you, teacher. Thank you.
Jayika, yours next.
Hello,
can you hear me?
Yes, of course, Jayika. Hi.
Oh.
Hi.
Now,
yes.
Fantastic talk. I have a few answers and some questions. One answer is to Professor Lama's question about that children hearing music and quietening down when it's played. There is some research from my perspective, what I remember from an audiovestibular physicians, is that there was some study, and I don't think it was replicated thereafter, where they got mothers to read, a group of mothers to read when they were pregnant to their unborn child, the book Cat in a Hat, by Dr. Seuss. And, if you look at it, it has a sort of rhythmic quality. And interestingly, they found that the group who read to their child, they could quieten the child down and the child would start sucking regularly whenever the mother used to read the story. However, interestingly, they've also found, of course, the mothers who didn't read it couldn't quieten the child down by reading Cat in the Hat. But if you got the father to read the story, the child wouldn't quieten down. So there is something, not the words, of course, it's the rhythmicity and the quality of the voice which the child would remember. So then, from that, another thought came to me, is that are we sort of classically conditioned from in utero to appreciate certain types of music and our choice of music? Does it just accumulate from there on throughout our life and sort of make our preferences? That's my question.
Yeah, there is this idea. Thanks, Jayika. Thank you very much. By the way, Jayika was, I don't know whether how many of you know. Jayika is an artist, and he has been an engine of creativity. And, we held an exhibition in 1974. It was all due to Jayika's initiative. And it was at the Lionel event called Asymmetric Ripples. And again, the name was also given by Jayika. So our friendship goes long before that, also to Cora Abraham's classes when both of us attended. And one of the people in Cora Abraham's class, Lucky Senanayaka, who has taught both of us, he died recently. So that's just a bit of an anecdote. Jayika, I think there is, what you bring out is a very important point, because there is this idea that the heartbeat also, which the fetus must be hearing from the mother, is something which programs us. And this whole idea that we are hardwired to certain music is, there's one theory, that we are hardwired to certain types of rhythms and music. But I haven't really looked at it in great detail. But you find that there is a definite cultural impact also, because now some of the music which is totally alien to us seems to be causing a trance in that particular culture. You see, they seem to enjoy it so much, and it's part of them. So how much of it is you're born with? There is a certain amount which is born hardwired for music, because just like Chomsky's theory that hardwired for language, you're probably hardwired for music also, but then the cultural environment takes over and then changes our wiring, as it were. I hope I answered that question.
Thank you. That was very enlightening. I put a little quotation there on from Voltaire on the chat. That where is it now? That
The art of medicine consists in amusing the patient while nature cures the disease. I suppose yes.
Yeah, maybe we should be singing to our patients.
But certainly, I mean, this whole idea of having, especially in our setup, we have wards which are drab. There's nothing on the ceiling. There's nothing on the sides. They don't allow. I mean, they don't even want in some of the wards. They don't want you to hang a picture. So it's. I think those things have to change. It has changed in the female wards and certainly in pediatrics. Now, when we were students, I think the trend was just beginning, where pediatric wards had paintings of cartoons, figures, and so on. But now it's spread all over. I mean, I'm talking of Sri Lanka. Most pediatric wards would have pictures and nice colors and so on. Thanks.
Thank you.
Mahendra, your turn next.
Thank you. Saroj, that was extremely interesting. I really enjoyed it. I have two areas to ask you questions. They're related, but may not be. I don't know. Firstly, you mentioned the role of evolution, and that is accepted. What is not sometimes accepted is that group behavior, which promotes living communities cooperating with each other, is obviously good for survival. But music also provides a protective mechanism, because by shouting and making big noises, you can frighten predators. So that's another aspect of music. What's fascinating is that although Homo sapiens arrived about 300,000 years ago at least, language seems to have arisen only about 40,000 years ago. It's such a long time. So that brings to the next question. You're probably aware that some workers from McGill University showed that when you process the brains who are listening to music, the melody, rhythmicity, and all the rest of it seems to be mostly processed by the right side, whereas the frequency and words are mostly by the left side. And your ability to remember songs is much better in terms of words if the words have some kind of frequency. So that's why we, for example, say the Sinhalese one. I wrote it down. Kastara kostara urata kurumba ambata wambotu. So that thing makes you remember it. So what I want to ask you is, what is your understanding? Because is there a difference between what happens to your brain when you listen to music, which is purely instrumental with no words at all, or music which is both words as well as instruments? And then going right down to it, what is music? I mean, is chanting music? Is spirit music? So what is your own understanding? What is music? Sorry to ask you such a lot, but that's what sums it up.
Yeah, thanks, Mahendra. Very interesting questions. The first one, as it were, what you mentioned is correct, because the brain seems to have been there before language came in. The size of the brain seems to was there. It was, but it didn't And there is this theory that language probably hijacked an existing brain, and this brain was developed because of its the need for social networking and group communication between groups. So your point that certain calls or shouts or music would have helped the group to be cohesive and also for its survival is, yes, I think that would have played a role. And this idea of survival of the fittest, I mean, now increasingly we realize that there's nothing called survival of the fittest of the individual, and which justifies all the bad things in society by saying survival of the fittest. So you rook your patients for survival of the fittest. Now that doesn't, it is, and they try to link it to evolution and give an evolutionary justification for what they're doing. Well, there is no such justification. And what is increasingly coming out is that cooperation and behavior together is the one which helped society to develop, as well as humans, to these Homo sapiens to really overtake and annihilate the other humanoid species. So Neanderthal was probably the last one which had no competition for the brains of the Homo sapiens. So that's one thing. Then, as regards to what music is, very difficult to define, and this demarcation really, when you go right down, what's the demarcation between a sentence which has a certain tune versus a bland statement of a sentence, and then the sentence becomes a song. So that's a difficult definition. I think it might be something to do with the acoustics and the sort of changes in the notes which we've got to look at. And I'm sure there is research in that, and we should look at that area. Then the other point you asked was whether instrumentals would have an effect different from what when you sing. Yes, the instrumentals would evoke different emotional as well as memories compared to a song which has words, because the words themselves will trigger certain emotions and meanings. And this whole thing goes, I think it's very interesting, because when you're used to certain types of music, certain rules of music, the octaves or the key and various things, and suddenly you get a composer who comes and breaks this whole system and changes it. And then the reaction of some people who would really love that new composition, the new style, as it were, and take on that. I can't remember the names of the musicians, but they describe this in the literature of how, where people have really changed the whole structure of the traditional music at one stage, and then you start having appreciation of a new sort of new form of music. So that's the amount I know. I'm happy to look at it further at some stage. Thank you.
Thank you, Saroj. I'm glad that Mahendra came in with your question. We all know Mahendra's huge musical talent, but certainly in this group. But few of us know Mahendra as the second neurologist that Sri Lanka produced after J.B. Peeris, and he was the first neurologist to be posted to Kandy. So brain and music are wired very hardly with Mahendra. Anyway, next is Rasika, and after that Shian.
Hello, Saroj. Fantastic presentation. Saroj,
Thank you. Yeah.
would you mind turning your video on? We'd like to see your face, if you don't mind. But anyway, I've
ඒක
got...
හරියට එන්නේ නැහැ. Right. පේනවා. හරි.
නෑ, ඔය හොඳයි ඉතින්. You
Oh,
you can't improve on that anymore.
What to do? It's genetic. Yeah. Okay.
But I've got like 3 questions. I hope I'm not dominating, but
No
they are related to what's been already asked by Mahendra and Jaika. So, and to some extent Lakshmi. So you said about how the blood pressure calms down and all of that with music, but there is the personal choice of music. For example, I like certain types of music, but Ajanta has it full blast, a different type of music that doesn't, appeal to me. And therefore, I don't think if I'm on my deathbed or I'm ill, I would particularly like that music. That's not going to calm me down. And to that extent, I think Pirit, for example, the chanting is a sort of music, and that has a calming effect. So where does this personal choice come into it?
I think it,
question.
Yeah, can I answer that? Yeah, I think that's something which you learn and which you grow into, and that's why you find now. I mean, Pirit, we are very familiar with Pirit, and it calms us. But if you ask some of the people, unfortunately, when they hear the Muslim prayers going, they get irritated, right? They can't. They say they can't. But whereas if you ask the Muslim person, they really love that, and it calms them and reminds them of God and their religion. So I think it's a learned behavior which we have. Whether there is a universal formula is something which we don't know. But interestingly, now they've started to, some of the songs, you would have noticed that the songs which come to number 1 on the hit parades, very soon the same artists come up with a similar song. It's not the same, but it's slightly similar. And there are people who actually compose using computers, because you can now, there are programs and artificial intelligence and so on, which will tell you what are the key elements in that. So your next song will be fairly similar, because you are trying, at the end of it, they are not bothered about creativity, they are bothered about how much they're going to make with that song. So that's probably one thing which happens. So I don't know whether I answered your question to some extent, but yeah. So you think about periods and things, yes. So I think it's cultural. It's partly cultural.
Can I contribute to that?
Sure. Yeah.
In the operating theaters, we sort of listen to music just to calm the situation quite a lot. And I can tell you that the most calming type of music is the Japanese music that is common to quite a lot of the surgeons. The calming drums and calming water falling onto a vessel, that kind of music is so calming. It just helps your subconscious brain to concentrate on what you are, on the task at hand, as it were. Just a side comment on that. So it's not always cultural. That's what I wanted to say.
Yeah. So how much of this is, whether there is a generic formula of music? There might be a generic formula which is common to all music, which, that's something I haven't really looked at. But if we assume that there is some hardwiring for language, I would assume that there is some elements of a generic formula which are there. Yeah.
So my next question was about the compositions, and you spoke about the musical composition. But as you know, I compose lyrics, and which parts of the brain, or so like when I listen to anything, it is the lyrics that focus on the goosebumps go with myself for the lyrics, because that's what I am geared to, I guess. Can you elaborate on?
Yes, actually, I looked at that area because the musical composition, as I mentioned, the areas related to words and things get suppressed. But when it comes to poetry, it's a different one. And they talk of activity in the medial prefrontal cortex and decrease in certain areas. So when you look at the creativity process, you're seeing different networks which seem to be firing for different types of creativity. So poetry would be one, your artistic would be one, your musical would be one. But at the core, there would be certain common areas which fire. But certainly, it's different. So because in as you quite rightly mentioned, for the people who are on to poetry, it's the words which actually, with the rhythm and the words which are used, which cause the artistic thrill or whatever. Yeah.
Thank you. So finally, I want to touch on what Jayika said about the in utero fetus being exposed to music, and you've said about possibly the ability of the fetus to listen to this. Does that generate any later talent in them for being musicians? Because anecdotally, you hear of people whose parents and the families have had no musical talent whatsoever, but they've been exposed to music in utero and they become great musicians from a very young age.
So I mean, I think it's both, because there is probably a genetic component, but how much of it is, because invariably the people who are musicians will have music in their homes all the time. And now we have, there are some of our friends, there's one person in particular who, he listens to 6 or 7 hours of music every day. Right, and in our lives we might be listening to maximum 30 minutes or half an hour, but that's also not on a regular basis. So I think different people will develop their talents, and there is probably a genetic component also, which is, and there is a part which is learned, and exactly what sort of proportions will vary. And you find certain, there are the savants who have, for example, they have other issues like, I mean, they're Asperger's or that sort of illness, and or development issues, where they're very, very talented in a particular area. And then you have people with certain mental illnesses who are still talented. Now, one good example is Brian Wilson of the Beach Boys, how despite his schizophrenia and it's all fragmented, he describes how the different parts of the music comes to him. So he knows how the vocals should be, then he knows how the drums should be, he knows how the string instruments and the guitars should be, and so on. And in fact, it's combined later on. So all I'm trying to say is that it's a very personal thing, and there'll be different permutations of how the hereditary part and the nurture part, the nature and nurture, part plays out in each individual. And as you quite rightly mentioned, there are people who are child prodigies or who are genius, have they come out without any sort of link to a family of musicians. So
Thank you, Saroj. Now we'll give the floor to Shihan for your question, please.
Okay, thank you for a very illuminating lecture. I learned all about neuroplasticity today. It's about relationship and the music with music and language and the effects of music on language acquisition. I wondered if people brought up in a multicultural setting have any advantage in acquiring languages in adulthood.
I haven't looked at it, but I mean specifically, but certainly multicultural and certainly bilinguals have, if we give them the access to 2 languages or 3 languages, it certainly helps in their cognitive development. So that's something which is known. So presumably exposure to different cultures would have a positive influence. So I haven't looked at that in particular, but I would expect multicultural environments to help in improving some of your cognitive skills.
And the same goes for music. Are people brought up in sort of with listening to several types of music from their childhood? Are they able to be better musicians later on?
Well, again, I don't have hard data on that. I haven't looked for, but if you look at the breakthroughs in composing comes with exposure to different influences. So, for example, one of the changes which happened to the music of the Beatles, they say, was after they were exposed to the raga and Ravi Shankar during their tour of India. So there are anecdotes like that. And you find even other musicians who experiment with different types of music. So Simon and Garfunkel would experiment with African rhythms. So in Sri Lanka also you find our own singers experimenting with traditional forms of music. So this whole thing about fusion is this trying to bring in the different cultures. And you see, when you look at the neurological basis, you realize why musicians say that language of music is universal. Because you're at the end of it, neurologically, there is so much of similarity in the response you get. It doesn't really depend on which type of music you're listening to. If you like it, it can be from whatever nation. You still enjoy it and you'll have the same reaction. Mm-hmm. So as Rashika mentioned, your personal, it will be a very personal choice. There's no universal music which people will like, which everybody is going to like. But there may be some deep down, we don't know, like a universal grammar of Chomsky's language. There might be some universal formula which is there for music, and we grow on that fundamental. So interesting area.
Thank you.
Well, one thing I have recently learned about music is the musics that the babies appreciate is the music they hear in the womb, and that is the mother's heartbeat. And this heartbeat is captured now in an app. And when the child cries, you put the the heartbeat music next to the child, and generally the child calms down. Same applies to the shoeing of the mother's shoe is captured in an app, and you can easily use it to lull a child to sleep. So that's an answer to one of Professor Namamad Surya's questions. Anyway, Ruan, you got a question?
Couple of questions, but before going to the question, I'll make a comment about your comment as well, Ajantha. I think we have a pediatric condition called colics, infantile colics, where in English we call it colic, and in Sinhalese we call it balagiri dose. So the treatment for balagiri dose is you apparently put up a label on the room, the entrance to the room, saying balagiri adaneme heta. I think Professor Lamawat Suri will know this. So I think instead of that, we can put music to correct the balagiri dose, because that's the same thing, children crying incessantly, I suppose. Anyway, that's the jokey bit. But the question I really wanted to ask you, Saroj, is music, is it a universal, or you said it's universal for humanity, but is it the sense of music, is it in animals, and is it a distinguishing feature from humans from animals?
Very interesting question, because you find animals also develop very sophisticated tunes, and even the birds, they do have tunes which they develop, and the tunes also evolve. It's not the same tune which they seem to be singing. So with generations, they change the tune also, but it doesn't seem to have most of those are related to mating calls and things like that, whereas it hasn't developed the way music seems to have developed in human society. So there is a similarity, but you find they train these parrots to talk and to answer and to sing, and some of it is parrot-like. I mean, they don't know what they're saying, but there might be a certain component of creativity or whatever in them.
So, Saroj,
Ajantha, could I ask a question?
yes, please.
Now, Saroj, there are some parents who are very, very enthusiastic about teaching music or teaching musical instruments to their children very, very early in their life. Now, is there a way of doing, for instance, an MRI scan in those children and identify whether they have a potential for music?
I don't know of such studies. Of course, with the children, there would be some issues of doing such studies. One is, even though we say it's very safe, whether we should be getting children to go in that inside and get an MRI scan. So that will be one issue. But looking at the literature, I don't think there would be able to identify a particular aspect of the brain which predicts musicality, or I doubt whether such a thing would be identified.
Thank you. Udita is next.
Okay, thank you.
Followed by Robin.
Hi, Saroj. Thanks for your talk. I just want to find out from you for your evidence in brain injury rehabilitation. What's your evidence for that?
Well, those are the studies which have been done. In most of those have been randomized trials that they've done of giving them those groups music over a period of time using earphones.
Is it the cognitive improvement, or what's the specific evidence? Do they cognitively do better if they have music therapy on top of standard therapy, or what's the evidence?
Well, I can't tell you the specific papers. I've got the references if you want me to have a look. But in most of these, even with stroke rehab, you find cognitive as well as other physical rehab rates improving. Now, the few studies which they have done in Sri Lanka, that's Ruwan Ekanayake, and now that was of course cardiovascular. But you see the sort of physical improvements. One of the studies was where they looked for the stress ECG, and according to them, over a period of time, if you listen to the North Indian Carnatic music, your stress ECG, the deterioration is slower. So presumably such biological effects can happen with the neurological also. I would expect it to have an impact on the physical as well as cognitive.
Can I just ask additional question on the same lines? What's the effect of music on anxiety and depression and things like that? Has there been any evidence?
Oh, yes, there is evidence. Again, the type of music will matter, and the preferences plus the type of music matters, and there's enough studies on that, on anxiety, on positive impacts of certain music on to reduce anxiety levels and to improve the mood.
Thank
Thanks,
you, Robin. You're
Thanks.
online. We have just consumed 2 hours of your time. How long can we go on?
I'm okay. I mean, whatever time you want to.
Ruwan, is there a time limit that you want to put on it?
No, just let's carry on as long as there are questions.
Okay, Robin, your turn. You're muted still.
Well, I was unmuted for a while, and then my clock chimed to tell you all it's 11 o'clock here. So I went back on mute. Anyway, Saroj, as I said in the chat, awesome presentation. Enjoyed it a great deal. So I'm now trying to take umbrage with Ahantha. He said that you have no clue about music. What he doesn't understand and what he doesn't remember is that, the only guy who could sing some of the kavi that I used to sing better than you was Ranjit Pathiran. Unfortunately, we can't sing those kavis here in this format. So poor Ahantha he lived a very protected life, and then Rasika made it more protected. So it's very so correction. This guy knows the same songs that I know and much better. That's number one.
Robin, he was hardwired to that kind of music.
Okay, well,
that's a separate center, Maya. That's another center in the brain.
That's the one. But it's a very important center because Saroj and I are highly developed in that area. Anyway, so having said that, when I came from Kandy to Colombo, I was living in this house with some shall we say, some dubious boarders. And on Fridays and Saturdays, some of these guys used to bring this good ganja from Velavaya. ganja. Can you hear me?
Yeah, we can hear you.
So, and I had these sort of blue plastic records that used to play heart sounds. You remember there were some of the older ducks will remember they had this, the pharmaceutical reps would distribute these heart sound things. So you go da-dub, da-dub, and they had different things like, for mitral stenosis and whatever. So when these guys were smoking their dope, I would play these heart sounds. And some of them, so this is going back to Rasika's thing and somebody else about prenatal heart sounds and whatever. Some of them were very soothed and very, happy to hear it, and of course they were high as kites. But then there were these other people who got terribly agitated. So I'm just making this as an observation. I don't know whether you have done any studies on this, Saroj, but I can get some functional MRIs done here for people on ganja if you want.
Thanks, Robin. Thank you.
Robin.
The link between some of the drugs and LSD and music is something which has captured the interest of musicians as well as researchers, and there are quite a few studies on the impact of especially LSD because of its psychedelic experience. So interesting observation. Interesting observation.
Thank you, Robin, for enlightening us on CD.
If you noticed, I didn't say that I smoked that stuff because I was always conscious that Professor Lama might walk in.
Robin,
yeah.
I correct you. At that time, I was not professor, I was doctor.
I remember that, yeah.
Sam, you are next.
Hi, Saroj. Thank you for the excellent
Sam.
talk. Yeah. One's a comment and one's a question, if you can bear with me. First, as you mentioned, if you recognize two individuals who are equivalent, goes down the road and one's a Buddhist, one is a Muslim, and see a Muslim, the Buddhist guy will really get angry. And if you see next to that see a temple, he feels angry, the other way around. Similarly, the Pirit and Muslim. In a similar way, why don't we advise the UK people for the Eurovision to what the people been conditioned before, at least they will get at least 1 point the next time around.
Anyway, there is a question from Mahendra. Mahendra, do you have a question before we...
Right, I'll make it very short. I'm sure Saroj won't disagree with me. fMR studies are very interesting, very important, but apart from showing certain areas which glow depending on what you're doing, what it has shown us is that the brain works as a committee. It's an integrated whole. Our idea of a frontal lobe, parietal lobe, and so on, even anatomically is not there. It's just a cerebral cortex. So we work as a whole. But what's most important to me in fMR is that it's just shown how areas can actually grow with constant stimulation. You can show that size of certain areas become bigger. It can be shown in meditation, with music, and so on. So that's one observation. Other one is about what Lama asked about children. I honestly don't know how anybody can show whether there is genetic predisposition for somebody to be a great musician. Because we certainly know that we are all influenced by genetic, epigenetic, and cultural influences. Of course, strong Buddhists would bring another influence and explain why you get wizards like Mozart saying that we carry over something from our past births. Now, that's not science at the moment, but that's the only explanation I can give, Sanat, that if your father and mother in your previous birth was a great musician, you may have carried something, but that's pure conjecture. Okay, but the first 2-3 years, as you know, are absolutely critical. There have been studies showing that children who are grown up in a musical environment with father and mother both, they are better at music than those who haven't. The same thing with languages. Children who have grown up with more than one language, they are better, and the IQ also supposed to be better, but I'm not really sure about that. Sanat might know more. Thank you.
Thank you very much for that point. I briefly mentioned it about the connectomes and about functional MRIs. There is controversy on interpreting functional MRIs and whether this is something which which really captures anything of significance or whether it's just a imagination on our part. But right now there is reasonable amount of evidence with meta-analysis and analysis of the sort of pictures you get from functional MRIs to show, as you quite rightly mentioned, that certain areas are predominantly affected and certain areas seem to grow. But you're quite right. That's when you talk about the network. So now the next generation of studies are in what we call the connectome. So you're not really looking at pockets or modules of function, but you are looking at the connections, the pathways, and that's what they talk of as the connectome. So whether the connectome changes or not is something I don't think we still know whether the connectome changes. Some of the minor changes might happen, but whether there are large changes which are significant, there is probably recruitment of new connections and new pathways. So when a person who's had an infarcted brain is starting to walk again, they're recruiting alternate pathways, and the alternate pathways are developing, and the cells are developing new connections there. So yeah, you're right. We are right now we are talking of functional MRIs, and that's not going to be the end of the story.
Yeah, thank you.
Right. Can I ask a question? This is Mewan.
Yeah, please go ahead, Mewan.
Thank you, Saroj, for the lecture. And I had told him in the past that I dropped the word professor when I called him, but for some reason I called him by first name. Also, recent felicitation when at his retirement. I was asked to write something, and I was looking for a word. The word I came across is sort of close to what Ahantha came across. He used the word controversial. I used the word dissenting opinion, vimatadari, so it was always a pleasure to have you around in here as well as in the forum, Literary Society forum on the website. The question I have is actually, I got some exposure to medical students lately at the same place, University of Sabaragamuwa, and I came to know of Professor Lamabadu Surya's pioneering work there, and have had interactions not in medicine, but in physiology and pharmacology lately. What I came across is there, as well as when I listen to my colleagues who have now children at various medical faculties across the country, the medical students today are far more aesthetic oriented. According to one of my friends who was a former dean, to a fault, they seem to be focusing on other things than just medicine, which is a very heartwarming thing to hear. And I saw that too. And recently, Sabaragamuwa students sent me a website where they had created an artistic forum where you digitally enter like you're entering the Lionel Venn gallery, you enter their artwork all digitally. Music is the same, and so on. So the needle has moved significantly, and I'm sure you are behind it to some extent. But is there anything structured, or is it just allowing medical students to come out and express themselves variably, or is it like promoted in a systematic manner?
Thank you very much. Thank you very much for those kind words. Yeah, very important point you brought up. So you see, this whole our what shall I say? This progress towards introducing humanities. When we started, we looked at the connections between the neurophysiology, and that's how this whole thing has developed. Because we were focusing on I was focusing on neurophysiology because I thought that that would be the easiest way to convince people. See, if I tell anything else to a medical person, they are less likely to agree. But if I give them the neurological basis, then they will say, this is something which we can think of. So you're quite right. The students now are really talented. And if you look at the quality, and Aja will remember how we pioneered the first, the concerts we had for the first time. Actually, we brought in people like Nanda Malini and Amardeva and Edward Jacody and them to the Faculty of Medicine in Colombo at that time in 1970s. So, but right now, the students, when they perform, they have their ninada, which they have every year. I mean, it's absolutely professional standards. It's you can sell tickets even to anyone else. Whereas during our time, those are amateur performances. So yes, you are right. They have shifted. The second question is very important. Have we done anything to bring this in? I think that's what we are trying to do, which we did to some extent in Colombo, and what we are trying to do in Sabaragamuwa. And it's very nice that you've asked that question, because we discussed about bringing in humanities in a structured way at Sabaragamuwa, so that it will be part and parcel of their timetable. So a performance would be part of their timetable. Appreciation of art, which we did even in Colombo, would be part of their timetable and curriculum. Not that we have to give them marks. We need not give them marks. But the mere recognition that art and music and so on is part and parcel of the faculty, I think, drives home a point. And it helps people to get another balance. So we are trying to do that with in Sabaragamuwa also. In Colombo, we've done it, and some of the people who are working there. I mean, Priyadarshini, Panduka, Diniti, and them. We've developed a program where we give them novels, songs, films, and so on, and they're supposed to discuss, reflect on the creation, and come and discuss in small groups or in seminars. And they're amazing. You realize that it's actually they are advanced, so they will critique a novel or a song with so much of information that the teachers are we are nowhere close to what they do. So you're right. The scales have shifted, and we are trying to bring these in to the faculty by recognizing it. And I think the importance of making this neurophysiological connection is that it becomes more acceptable for people, and it becomes easier to justify the curriculum. Yeah. Thank you, Mewan. Thanks.
Mewan, thank you very much for that comment. We have come across, or we have been associated with colleagues or trained people who were so multi-talented, starting from Aloka Patirana, Harsha Jayamana, Ransit Muddu. They are experts in music as much as their speciality. So that is something that was not there in our batch, certainly, except for a few people like maybe Jaika, who was a superb artist, and
Karu, music.
And Karu, and then Saroj, of course. So it is very, very heartwarming to see that talent coming through. The balance that they have in their life is fantastic. Thank you very much. I think Ruan was waiting patiently for the next question.
Saroj, my second question is about this phenomenon, musical related phenomenon called perfect pitch. So there are lots of things I think known about that. One is that it's highly genetic, apparently. It's a rare, not a common phenomenon, it's a rare phenomenon, the ability to identify the exact perfect pitch. The second thing I know about that is that even if a person has the ability to recognize the perfect pitch, if that person is not exposed to music before the age of 6, they will never develop that ability. So, in other words, what they're saying is, if you are not exposed to music before the age of 6, you are very you can't identify the pitch and you won't be able to sing properly. Now, do you know anything more about this phenomenon called perfect pitch?
No, I've heard of it, but I mean, I've heard like what you've said, that there is a genetic component also, and this brings in again this issue of what sort of what's the hard wiring we have for music. So perfect pitch is one such example we seem to be having, which is genetically determined.
Thank you very much. So, I think that sort of brings to an end the discussion phase, because I'm conscious of the time. Saroj, would you mind spending the next 5 minutes just describing the COVID situation, because it is at the forefront of our thoughts about how Sri Lanka is coping with the current upsurge?
Right. Before I get to COVID, I must thank my brother. I saw Ayya also in the audience.
Yeah.
Yes.
Yeah.
Yes. Hello, Ayya. How are you?
Bad. Only you like to see my COVID look, okay?
Yes. Show everybody. Yeah, cool. Oh my God.
I haven't cut my hair after Nadisha's wedding.
Oh, right. Okay.
Because I can't go to the place to cut the hair, right?
Yeah. That looks very nice. Very nice. Yeah, because Ayya is also here. I must, though my parents put me into music as a child, so I used to go for Sita Joseph's music classes, and I've dabbled in various musical instruments, but never ever, was never an expert in anything. My father used to sing, and he used to sing Italian songs, and he used to go to Lily Godrich, but we never took that on. And then he used to do this Jayamangala Gatha classical sort of music also. And my brother is the one who was, Ayya was Ravi, he's the one who was interested in Beatles at that time. And you must remember that the only way you could listen to music was, initially you might get it through BBC. Otherwise, you have to wait for 3 or 4 months for the music to come in a disc to Sri Lanka. See? So, unlike now. So, it used to take, the hit parade used to take about 3 months. And of course, he's the one who introduced me to the Beatles, plus also some of this about Amaradeva and Nanda Malini, and that was the height of there. And that's famous program by Vittaratnayak called Sa. So it was a hit during that time. Some of you might remember. So thank you very much, Ayya, for all that. And
Mali, I have a small comment, Mali.
Yeah, sure.
We listened to it without any medical background. We were able to follow everything very well. It was clearly explained by you. It's so nice. Amma and Tat would have loved it.
Thank you.
Another thing about evolution of music, I was reading about it, and till about 1980s, the anthropologists were interested studying the music of our indigenous people, the Vanyalato, because they had 2-note music. Today we have 7 notes. They had 2 notes. In the 1980s, they started searching for the 1-note music. And they came across, these anthropologists came across a group in South America called Kashka, who had 1-note music. So now we were able to go back to discuss that, and there were only 100 people surviving with that 1-note music. Then came our indigenous people. After that, just a matter of interest, period is supposed to be 4 notes. And today we are in 7. I don't know whether we can go up to 8. I don't know whether we are able to go there. So evolution of music from 1 note to 7, they were able to trace. We have a
Thank
big
you. Thank you. Yeah. Thank you. Ajay. Thank you very much. Yeah, it's interesting.
Ruan, do you have another question to ask? Okay. Saroj, just spend a few minutes on the COVID situation and how Sri Lanka is coping, please.
Yeah, so now we are on the 3rd wave. First wave, we were very successful, crushed it. Second wave, we had some setbacks, and 3rd wave has hit us hard. Right now, I've jotted down some of the figures. We are talking of 221,000. Yes, 277 confirmed cases and 2,136 deaths. And we are averaging 2,300, 2,500 cases per day and 50 to 60 deaths. That's the sort of rates we are now having. So right now it's a lockdown. There are severe restrictions. You see vehicles on the roads, but you don't see people, many people on the road, and it has brought things down. And now the problem is to see whether it is effective. Now we have 2 issues there. One is the testing. You will know whether rates are coming down depending on the number of tests you do. The number of tests also is averaging around, I think it's around 20,000 or so per day. I can't remember the exact figure, but that's the sort of figure I remember. Anyway, the testing will determine. Second thing is, if you have some restrictions now, the effect would come after at least 1 or 2 incubation periods. Because the idea is that when you restrict like this, so that if there's a household which has got the virus, you infect to everybody else. If you are going, they are going to get infected. And since you are not going out of the house, the virus will stop, will die off with that in that household. So that's the idea of these lockdowns, so that you won't take the virus. So you need at least 2 incubation periods for you to be absolutely sure that that household will not carry the virus. So therefore, the figures of an impact takes time. That's the crucial. It takes 2 to 3 weeks. So even if you stop everything for 2 weeks, you still might not get the figure going down. Then the second problem we are having is the death rates. Now the death rates seem to be going up now, and that was predictable, because your death rate today is determined by the rates of COVID 2 weeks ago, 2 or 3 weeks ago. Because only when those who have got infected 2 or 3 weeks ago will fall ill, go to hospital, and then die. So you're talking of a lag period there also. So even with the strictest controls, we say tomorrow COVID transmission stops. By a magic wand, we have stopped COVID transmission. But even then, the death rates are going to go up tomorrow, day after, day after. And then it will start to plateau. Now, from the graphs which we have, it looks as if the things are plateauing, at least the rates and the deaths are on a plateau. It's not, it climbed very fast, and then it seems to have plateaued. So that's the sort of situation we are in. There are various other reasons why it's plateauing, and the other important reason is the vaccination, because we've already vaccinated close to 10% with at least 1 dose. We've done fairly well. There's a lot of confusion at the front line about getting the vaccine. That's unfortunate. And also there isn't the communication strategy of the government is, no, I mean, the health is not at all adequate, suboptimal. So as a result, there is a lot of confusion. But if you look at the figures from other countries, we started vaccination fairly early, and we have done about 10%. Things should improve in the sense there's always the potential for much more rapid rates of vaccination. There's no doubt about it. So that's in a nutshell. So deaths also, we are talking of about 78 or 80% of deaths happening in hospitals, but about 20% are happening in before admission to hospitals. That's the current figure. And then most of the deaths are in people who are above 60, 65, and those who have got multimorbidities like diabetes, pressure, and heart disease, and so on. And people who are vaccinated, very few are getting infections, and very, very few are falling seriously. So that's in a nutshell what's happening, Aja. I hope, but I'm willing to answer any other questions.
Saroj, are there any
yes,
people who are anti-vaccine people like in other countries?
What
movement here, and I mean, young people, they have certain theories on their own, who are very dogmatic. And are there any Sri Lankans also like that?
Yes, unfortunately, WhatsApp has created havoc at one level, because now you find all these anti-vax groups in US, recently we found that in some of the areas, less than 10% have got vaccinated despite the availability of the vaccine. That's so strong, anti-vaxxers. And in Texas, they are charging people, the governor or one of the people there, they're going to charge people who force others to wear masks. So you have these different extreme views now coming on the WhatsApp groups and the internet, and then our people seem to believe. Some of them are believing in this, and even today there was one saying that people who have vaccine should never undergo a local anesthetic because so and so has died of when the local anesthetic was given. And we had some resistance to the vaccine with the initial AstraZeneca. See, when the initial AstraZeneca was distributed, there were several nurses who refused it. And at that stage, of course, the pregnant people, we didn't know whether they should be given, and they were told not to take the vaccine. So that is one reason why we found that there are people who have not been vaccinated in the health sector who required the vaccine.
Actually, I know few doctors who spread that anti-vaccination messages, and there are certain WhatsApp messages saying that if both vaccines are taken, that you will die within two years or something like that.
Yes, yes, that was a famous one. That was attributed to that HIV researcher from France, and there was another one supposed to be from a Nobel winner from Japan, and those were found to be fake news. Those were fake. So unfortunately, this has created a lot of. There is no organized anti-vaccine groups, but there are people very concerned about taking the vaccine, and people who postponed taking a vaccine because they were frightened. And the other thing what is now happening is there is the anti-Chinese lobby, which you are bringing in, saying that the Chinese vaccine is inferior, Chinese vaccine is not good, and so on. And that is also now people are saying, should we be taking the Chinese vaccine? So
Ajanta, could I come in?
Yes, please.
Thank you, Saroj. And I think I'm
Ajanta,
the person here.
Yeah. Ajanta and all others, 2 days ago, I went with two others and met the Prime Minister Mahinda Rajapaksa as well as GLPs. And what we wanted to say was that in spite of the lockdown, that we should try to open the schools as soon as possible. Because I have been seeing on local television in the villages, students traveling, walking up to about 5 to 8 kilometers and climbing trees to try and get internet access to follow online classes. And that is not at all a level playing field. And if it is allowed to go on, when they sit for competitive exams, the students in the bigger cities will be at a distinct advantage. And so our agenda was to try and get the schools open as soon as possible. And for that to happen, what we suggested was that for the school teachers and non-academic staff of schools to be vaccinated, as well as, when I say teachers, tuition teachers and teachers in private institutions as well, and also for children over 12 years to be vaccinated. And both Mahinda Rajapaksa and GLPs agreed with what we had to say. So that is what we are planning for the future.
Thank you very much, Prof. Of course,
Wow.
these are huge decisions. Of course, the children are the vectors of the disease and they can take it home. And these same questions were sort of considered very diligently here in UK. And there were 2 lobbies about education, you know, how to, even in a sort of advanced country like this, how to create that level playing field that you're talking about. It must be much more difficult in Sri Lanka, unless of course there is a test and trace and lockdown, local lockdown system at hand, because children are the vectors who may not suffer very much from the illness, but can spread it like a wildfire. And so those are issues that local politicians need to consider and make the right decisions for the country. Thank you very much for that update. So I think we have spent 2 hours, 40 minutes. Thank you very much, Saroj, for it must be nearly midnight there. Thank you for the audience from Sri Lanka. And
Ajanta, one last comment.
Okay.
I think some of you all may have seen a video of a Turkish village in a remote area in Turkey where they live in mountains and where they communicate by whistling. Have you seen that video?
Yes, I have. Yes.
Yeah. So anyway, there are other ways of communicating as well. And the children in that village, they are taught how to whistle and communicate from their formative years.
Yeah. Absolutely fascinating that was. Yeah. That's another
Right.
form.
Thank you.
Well, Saroj, in my introduction, I told that you knew nothing about music and that you really didn't know much more about the brain. So I have been proven wrong yet again about you. And thank you very, very much for enlightening us and keeping us entertained and informed. And can I invite the audience to unmute, please? And in the usual manner, we will applaud the speaker by clapping our hands. Thank you very much, Saroj.
Thank you very much for giving me this opportunity. It's been lovely meeting all of you. Thank you very, very much.
Thanks a lot.
Thank you.
All the best.
Okay. Good night.
Good night.
Bye.
Saroj.
Bye.